I would just be super mindful of the questions and making sure they understand what's being asked. Let's make sure I understand what I'm answering, because each one of those questions have a point value. And if that point value is not high enough, they will not get reauthorized for care. Can you cook yourself a meal? Well, sure I can. I can go and put a TV dinner in there and warm it up. Well, no. Can you cook long enough? Can you stand long enough to fix a meal?
Right.
Because if you can't do that, then you can't really cook a meal.
Right.
None of us want to eat TV dinners for, years.
Welcome to In Good Company, elder care in your backyard. Well, we have a special guest today. We're with the holidays coming. We wanted to make sure that we zeroed in on home care. And so for those of you at home that are maybe getting ready to go see someone, an older adult, or you're already caring for an older adult, you may not know what services are out there and how to best support them in the home. So that's kind of where we're focused today, is how we keep someone in the home safe and keep them out of that higher level of care. So we have a special guest today, Amanda Presley. She's the director of home care at Haven Home Health and Hospice, and she has been doing this how many years?
28.
28.
Maybe closer to 30.
Oh my gosh. Tell me how you got started in this area.
I got started as a caregiver when I was 18 years old.
Wow.
Yeah. It's just something you kind of fall into, and it's just, what you're meant to do. So
that's awesome. Mm-hmm. Could you define for us what home care actually is for our listeners?
So home care is typically non-clinical services in the home, personal care services, housekeeping, respite. We do have a clinical side for like med setups, vitals, things like that. But most of what we provide is non-clinical caregiving services.
So can you go, because I know this will be one of the first questions that comes across, is who pays for home care services?
That is a great question. We have lots of different payers. Of course, we have Missouri Medicaid. We have long-term care policies. We have VA, private pay services. That's about it. That covers it. Yep.
Yeah. And just curious, okay, so today, as it stands, we're in December of 2025. What qualifies you for Medicaid?
What qualifies you for Medicaid? It's based on income.
Okay.
And so there's different portions of Medicaid. You have to qualify for Medicaid first. But then the home and community-based services is the care that we're providing.
Right.
So the Medicaid is just the insurance that pays for the care. So the home and community-based services are the ones that authorize the care to be provided in the home.
Okay, well, that's a good distinction. So just because you qualify for Medicaid doesn't mean you're going to qualify for in-home services.
Correct.
Okay.
Very correct.
So just rough estimates, like what are the income requirements and that sort of thing?
The numbers have changed recently.
Yeah.
And so it's, at one point it was about $1,100 a month.
Okay.
But I think it might be closer to $1,300 or $1,400.
Okay.
And a lot of people don't understand either that you can make, let's say I make $1,500 a month. And let's say that the Medicaid limit is $1,400. So that person could still qualify for Medicaid with spin down.
Okay.
So that means I'm going to pay $100, call it a premium, call it a copay.
Yeah.
And then my services will pick up and Medicaid will pay. So I think where people get confused, or maybe not even confused, they don't even understand that that's an option. Because sometimes it's, oh, you don't qualify for Medicaid. Well, you don't technically, but I don't think that it's conveyed that way a lot of times. And so people don't understand what the spin down even is.
Yeah.
Or what it can do, or what help it can help them get in the home. So
yeah. So even if it's $1,300 or $1,400 a month, and we don't have the exact number, but even with that, they still could potentially qualify, because they have to do what's called a spend down. And when you say spend down, what are they exactly spending? What qualifies for spend down?
So most people just pay it out of pocket, like a copay.
Okay.
But you can use some bills to meet your spend down. So that would be medical bills, hospital bill, prescriptions usually would qualify. But the agency can help work with that participant to see what is going to meet that spend down or not.
Okay.
But most people, they just put themselves on it's like an automatic payment with Missouri Medicaid, and it's just auto withdrawn every month. And that way their services are never held.
Right.
If you pay it out of pocket and you don't have it on automatic withdrawal, then you could go almost 2 weeks into the month with your services on hold because your Medicaid's not active.
Got it.
Yeah.
Yeah.
So a lot of people just choose to pay it automatically.
Yeah.
That way.
Some people might think, if I want to get on Medicaid, I can't keep my house or have any other assets. Do you know how that works?
We usually will refer people to an elder law attorney. The plan, it's estate planning, but it's for Medicaid recipients.
Yeah.
And so that they can put a certain amount of their money to where they would then meet Medicaid eligibility requirements for income.
Okay.
And so, but we do normally, just because that's not where we're experts, we will normally refer to an elder law attorney for that.
Yeah. That's great.
Yeah.
So let's say somebody does qualify for Medicaid. They get on Medicaid. There's a couple of different options for programs within Medicaid to get services in your home. Can you talk about what those are?
Yep. So you have in-home services, which is usually 65 and older, I believe is the age range there. And then beyond that, you have Healthy Children and Youth is a program for kiddos. And that is from birth to 21. At 21 years old, they are transferred over to the in-home services program so they can stay on that service. And there's different waivers and things like that for someone that had very extensive medical needs. Sometimes those are deemed that they need to stay on that Healthy Children and Youth program, but normally they transition to the in-home services program once they hit 21.
Okay.
So I guess when I was explaining in-home services, it just dawned on me that it can be 21 in that case.
Okay.
But normally it's, I believe, the age of 63 or 65.
Okay.
Yep.
Yeah. And so kids can get on and transition. And what about strictly for older adults? What are the services that they can get on?
So they have the in-home services, and then there's consumer directed services, which a lot of families love because, so say I'm the recipient and I've got approval for consumer directed services. I can hire my daughter to care for me, or my niece, or my next door neighbor. And so a lot of people love that program because they can choose, like they're the employer. They have choice on who comes into their home. And so for families, it's usually a very well-liked program for that reason.
Right.
Yep.
So if they choose in-home services, though, what are the requirements of that agency to ensure the safety of the consumer?
Yes. So we have every agency that's approved with state has thorough background checks that they provide. Are required to do. And so every caregiver that goes into a home, even on the in-home services program, has passed thorough background checks. And then we have a training program to where they have 12 hours of training before they even step foot in a home. The training is very thorough. They're required pretty heavily by state to have specific training completed as far as personal care, Alzheimer's, dementia, Parkinson's, things like that.
Yeah.
And so they're not just being sent out. So the ones that they don't have family members that take care of them through CDS, they do like in-home for that reason, because they know that person has been thoroughly background checked and trained.
Yeah. So I'm sure the state kind of says what things you can do for that individual or not. They set up a care plan, that sort of thing. Can you kind of go into what what a caregiver is actually going to do for the state specifically.
Yeah. So for in-home services, they go in and they can provide bathing, dressing and grooming, meals, light housekeeping. So they can clean, they can meal prep. So a lot of families like for the caregiver to go in and they're cooking a few meals while they're there. And that way the client, all they have to do is go in and warm it up for themselves. They do shopping. They can go to the grocery store. They can run errands, do laundry, just pretty much anything. I always explain it to everybody. In-home services is in the home services. And so it's meant, the whole program is meant to be provided in the home where the client, stays.
Yeah. Yeah. So let me switch gears to private pay because that's a whole different animal.
A whole different animal.
Yeah.
So private pay is, it doesn't have the requirements that in-home services or even CDS would have on the program. So private pay is private pay. They're paying out of pocket or with a long-term care policy, and we set up the care plan according to what the client or family is requesting. It's a lot of times it's family members setting that care up for their mom or dad, but we do whatever they need us to do. We could take them to doctor appointments. It's the transportation, where it is not allowed on some other programs with private pay. It is. So we can take them to appointments. We can get them out of the house. We can take them to the park on a nice day or to a movie the sky's the limit.
Yeah.
Because there's just not any regulations that we would have to abide by. We do what the client wants us to do.
Yeah.
So
what's the craziest request you've ever seen from a private pay?
Oh man, that's a big question. Nothing's really coming to mind.
Yeah.
Besides a lot more pet care because we can't do that with in-home.
Maybe a favorite?
A favorite? Okay. Well, okay. I'll tell this story. When I was a caregiver, so a long time ago, I took a private pay client, a business owner, and he had retired. And so he wanted to go to his business, once a week or whatever it was to attend this one meeting and just check in. And we would always stop at, it was Dylan's back then, but Dylan's grocery store. And he would want these sticky buns. And so I'd go and buy the sticky buns. And then he'd always buy 2 sticky buns, one for me and one for him. And so I would just sit in his Lincoln, Cadillac or whatever it was, and wait on him while he went into his meeting. And then I'd drive him back home.
That's pretty
That's
cool.
awesome.
Yeah.
Yeah. I actually work for an agency. This is up in Kansas City, but worked for an agency that I didn't get to do this, which I was kind of jealous about. But one of the caregivers got to go on vacation with an older lady who was wanting to travel still, and she hired an aide and so she paid for their ticket and everything.
It's a great one.
They went on vacation together. I'm like,
That's a great
how do
one.
I get that gig?
Uh-huh.
But I think a lot of people, when they think of home care, they think, well, it has to be, this one thing. It's like all personal care and different things like that. But it really is like having a personal assistant sometimes. And you literally can sometimes get, the sky's the limit a little bit on what those needs are. And especially when you think about families and get-togethers, you could have family reunions, you could have, people coming in town and you're trying to prepare food and you still want to have like the old days where, you're cooking for 20 people or whatever. And that individual can't do that anymore, but they can definitely, lean on a home care agency to provide those services. So let me switch gears just a little bit because I want to talk about the dollars and cents because I think this is the part where some people get a little overwhelmed with it. And one of the things that I have always thought is that we had someone on recently was just talking about independent living, and she said like one of the things that she noticed the most was sticker shock. When they start talking about independent living, assisted living, skilled nursing, this higher levels of care, I don't know that people always know like dollars and cents wise, how much that costs. And, oftentimes when people are looking to make that transition, it's automatic that they're going to have to sell their home. And for some of those people, their home represented their, what they were going to give their kids. They may not have had a huge amount of, piles of money, but they knew they had a house that they could, bequeath to their kids. And so from a financial standpoint, like, because I know you've got private duty folks at different levels. Can you kind of dig into kind of the variety of how much gets used and the cost?
Yeah, and it is a big variety because, we go in anywhere from, 3 or 4 hours a week to 24/7. And so with that, I would just really encourage people to pay attention to like nursing home costs, because when you compare that with being able to keep your loved one at home, it's way less.
Yeah.
And where they want to be almost always. And so I would really just encourage people to, when you call and you hear how much a agency charges for private pay, they have to understand that it's not, these are people that we have passed through our backgrounds. Mm-hmm. And when some people will be like, well, I can hire someone off of, Facebook or whatever for so much less. They have to understand that that person hasn't been background checked. Mm-hmm. We're insured and agencies are insured, and there's no health insurance or anything like that. And so when they're talking to an agency, it's important for them to see the whole picture versus just what's going out of the one pocket to that person. So, I mean, there's a reason why even with like Missouri Medicaid that they have these services, is because it is more cost efficient for Missouri Medicaid to pay a provider to provide that care in that home versus sending them to a nursing home.
Yeah.
And so one of the requirements of the in-home and CDS is that they have to meet that same level of care. Yeah. That doesn't mean you need to be in a nursing home, but the point system that they use to qualify somebody is the same as that. But it does not mean, that you're like bed bound and your only option now is to go into a nursing home, because that's two totally different scenarios. Yeah. But
well, the nice thing about private pay also is that I think a lot of people think, well, it's cost prohibitive, but when you're talking about a certain block of time, and that block of time could potentially mean the difference between someone kind of rapidly declining faster. Because I don't think home care gets enough credit for the little things like making sure that somebody takes their meds, making sure that they're eating, making sure that they're doing a little bit of exercise, and that they have some companionship. Yep. I think that gets undersold sometimes. And families, unfortunately, don't know that investment earlier can really slow the decline of someone and not require them to go to that higher level of care. So it's kind of like pay me now or pay me later, but pay me later a lot. That's kind of how I've looked at it over the years, because it seems like we'll get people that are interested in home care and they needed a nursing home a long time ago. Like, I mean, they're really late to looking into this. And with a little bit of investment early on, it seems to make, it helps people stay in their homes much, much longer.
Much longer. And I think too that, we're not used to people coming into our homes. And so I think a lot of times, especially if it's family, hiring somebody for mom or dad, it's well, we need to get them used to it first. Like they don't need much right now. Right. Let's do, a few hours a week or, and get them used to somebody. Yeah. But then when that somebody they really form a close bond with the caregiver and the client. And so then when it is time to add a little bit extra, because now mom's declining a little bit, it's so much it's the transition is so much easier for the mom or dad or aunt or uncle or whichever. But it just so earlier is better. It's definitely. Yeah.
Yeah. And we've had clients, I mean, this is early on, but we had clients that, the family, they didn't have they didn't have a lot of resources, but they spent enough so that caregiver went over in the mornings, got, mom up and made sure she had breakfast and took her meds and, and that really got her off to the right start for the day. And then came back in the evening and kind of helped get ready for bed and, make sure that she ate and took her meds and, got tucked in good. And, normally that individual would probably have been in a skilled facility under other circumstances, but the family understood that investment of a home care person was really going to make a difference. And I mean, she stayed out of a nursing home for years before she ever, needed to finally go.
Yeah. That's what we're hoping to help.
Now, there are people who do have severe disabilities that home care helps them stay in their home. What level of care have you guys handled and how do you handle it?
We've handled anything. So from a paraplegic, quadriplegic, bedbound. I mean, we take care of people that literally cannot go without care. Someone has to be there. And so these people like that, they really come to depend on an agency to help them. And so those are probably our highest level of care that we provide. But even beyond that, I mean, they might have more advanced care requirements. Sometimes it's a lot more detailed on the medications. Sometimes it's catheter hygiene, or maybe they have a transfer device because we can help them get up out of bed.
And
you
so
a lot
like
of
a
times,
lift of some sort?
Like nowadays they're like electronic lifts. Back in the day they were the whole, pump lift. But I mean, it's just and caregivers have to be specifically trained to do that. You can't just send, a brand new caregiver in to do something like that. And those people, they depend on us in a different way. Like,
absolutely.
It's a very rewarding thing to take care of someone like that. And you leave their home and you're like, wow, that makes you feel like very blessed and thankful for being a caregiver. So.
Yeah, I think a lot of people would be shocked at what level of care we've been able to keep people in their homes. I mean, a quadriplegic requires a lot of hands-on care, a lot of assistive devices and strategy to be able to maintain things. And I think a lot of people assume that those folks are going to be in some sort of facility all the time. And that's just not the case.
No, we've actually taken some that were in a facility and it was not going well. And so we got a call. Is there any way, the one I'm remembering was on Medicaid, but is there any way that you could take me? I've got my services approved, to leave. And they couldn't find a provider to take them because the care was so extensive. And this lady had been in there for, I think, like 13 years or so. It was a long time. And so we said yes. And so she got to go home, and we took care of her until she had to go back. But it was years, we took care of her for years. And so it's people like that, like you can make a difference in every home you go into. Like every home, I don't care if you're doing some light housekeeping or taking care of a quadriplegic, they're both very important because, all of us want to be at home as long as we can. And so either way, it's very rewarding to go do that every day. So.
Well, we have a lot of people, we've done a lot of podcasts on dementia, and a lot of people out there terrified of, like, they know they're at the beginning stages and they just don't know where this is all going. Can you tell us about some of the clients or success stories you guys have had with dementia patients?
Yeah, I mean, we have a lot of experience with dementia. It's about finding what works for that person. Sometimes we see families that try to correct, like, no, mom, no, that's not how it happened. Remember?
Yeah.
And we teach our caregivers to try not to do that because, number one, that's not why we as the agency are there. But, I was taking care of a lady one time and she's like, oh yeah, my husband's going to be home anytime. Or her husband had died like years earlier.
Right.
And I'm looking at the daughter and, she's like, and I was like, oh yeah. Where does he work? And you just kind of, you gotta, it's their world and you gotta help them.
Yeah. You gotta go live in it with them.
Yep. You for sure do. And so, I think the sooner that we can learn that about dementia, the better off that we can help them.
Yeah.
Cause it's just a hard disease.
Yeah.
So,
well, caregiver burnout with, families of folks with dementia and Alzheimer's really is a chronic problem. And it's amazing to me what a little bit of time away can do, or even just, letting them go take a nap. And I have to sleep with one eye open, can really make a huge difference to some of these people's lives.
Mm-hmm. For sure. We've had some that were, they might, maybe it was private pay and they were just having us come in to just do overnights there so that they could sleep, because they're with them all day, and the burnout is very, very real.
Yeah.
And it can really cause, us to have our own health issues because we're so burnt out.
Yeah.
That, even a little bit of help coming in can make a big difference. So.
Yeah. Well, there's lots of folks out there who are currently on Medicaid, on in-home services that aren't, with our organization necessarily, but they're still out there and they're hearing all this stuff about cuts and different things like that. And kind of what are the things you're currently seeing going on right now that the general public should probably know about, at least people who are on in-home Medicaid services right now, just to make them aware?
I would probably just make them aware of the reassessments that will come due, and they will. And I would just be super mindful of the questions and making sure they understand what's being asked.
Yeah.
If need be, ask the assessor to ask the question again.
Yeah.
Let's make sure I understand what I'm answering, because each one of those questions have a point value. And if that point value is not high enough, they will not get reauthorized for care. And I think that my biggest fear is just that people aren't going to understand
right
what they're like. Can you cook yourself a meal? Well, sure I can. I can go and put a TV dinner in there and warm it up. Well, no. Can you cook long enough? Can you stand long enough to fix a meal?
Right.
Because if you can't do that, then you can't really cook a meal.
Right.
None of us want to eat TV dinners for, years for every meal.
Yes.
And
yes.
so, or, can you bathe yourself? Well, sure I can. Well, okay. Tell me, let's ask some more questions. Tell me about that. Can you, fully take care of that? Do you just need some partial help? Like,
right.
what do you need? Because it's the questions are not always a cut and dry, black and white, yes or no.
Right.
There's usually others. So I think the more we can help prepare people for understanding those questions and making sure they really understand the questions is probably going to be key.
Yeah. I mean, obviously we want people to be honest, but sometimes the questions are posed in a way where someone might be embarrassed to say they can't get into the shower, or they can't cook their own meal. And so they're going to answer, yeah, sure I can. But as a physical therapist, I will tell you that I can't tell you how many times I have gone into the home and I was like, can you walk to your bathroom? And they're like, yeah. And then I'm like, okay, let's do it. And they're like, you mean right now? And then we try to do it, and it's not good. It's not a good idea, not independently. And so that's the disconnect, I think, sometimes relying completely on a Q&A rather than on a visual demonstration, that I think the disconnect there is that people could potentially lose their services or Medicaid services because it is just a Q&A. It's not a visual, let's kind of prove it to me, that sort of thing.
Yeah.
And unfortunately, I think there are going to be people who are going to lose services inadvertently, and they're like, oh, I answered those questions that way and now I don't get the services anymore. Like, I didn't know that was going to happen.
Yeah, people are very proud. Like, they're so proud that I can still do this. I'm so proud that I can, trust myself or, cook my own meal
Right.
And they don't always like to admit, that they are having trouble with that. And so I think it's just, I always tell people, make sure you're answering questions on what can I do on the day I don't feel my best?
Right.
Not on my best day.
Right.
Because you don't always have your best days. You have bad days.
Yes.
And a lot of them, the bad days outweigh the good. So I think we're just going to have to really be good at educating people.
Yeah.
On be absolutely 100% truthful, but don't be so proud that you can't, that you answer the question not really accurately, even though you're trying to, but you don't really. So I think just helping them try to navigate that will be important.
When I was in school, they kind of explained it to me. Like when I was doing an assessment on how safe someone is walking, they kind of contributed to kind of like if you were going to make a bet, And so if you were to bet that if they were going to walk to that bathroom 100 times, that they weren't going to have a fall, then that was a safe bet, right? But if you suspected that there was probably a chance they were going to have a fall, you probably had better not assess them that they're completely independent. You need to assess them where you think the risk is. So that's the part that, kind of worries me a little bit about where things are going right now. But at the same time, I don't want anyone on services and getting services that doesn't really deserve it or need it.
Absolutely.
I want 100% it only to go to people who really do need it.
Absolutely.
I just don't want it to default and throw the baby out with the bathwater in the process of trying to do that.
Yeah.
Any misconceptions about healthcare or home care rather that you could address?
Absolutely. I think a lot of people get confused or just have a lack of education around home health and home care. Like almost any agency you call, well, what services do you have? And they're like, oh, home care. And then after a few questions, it's like, oh, well, that's home health. And so there's just so many different services you can receive at this, but I think it's mainly home health and home care. Like a lot of people understand hospice a little bit better. At least they can tell that, that's it's different, obviously. And so I think people get really confused that home health and home care are the same. And so then they're not. Home care is more, for the most part, non-clinical. Where it's caregiver services, maybe an RN, once a week to do an assessment, take your vitals, things like that. But home health is, doctor ordered, short-term, they're going in there to do, RN visits and therapies and stuff like that to get them better. Where home care, we want them to get better too. But it's a longer term service. And also as far as insurance goes, home health is, Medicare or Medicare does not pay for in-home services. And it's a very difficult thing for people because there's a big grouping that fall in that realm. Like you can't pay out of pocket. You can't qualify for Medicaid. Oh, but I have Medicare. Well, Medicare doesn't cover caregiver services. And so,
but they'll tell you they do.
They'll tell you they do. They'll tell you that someone on their Medicare plan told them, that it was covered. And so I would just encourage those people to call an agency, call and ask questions, and we can help navigate them. We in home care have a care navigator that can help them with answering all of those questions and get them on the right service for them. So that's very helpful to them.
Excellent. Is there anything we haven't asked that you would like to address?
Oh my! I think that was probably the biggest.
That was
thing,
the biggest one. I was waiting on that one.
The people there in the middle is just it's hard for people. You know, they don't understand why this one will pay and this one won't,
Right.
and then the Medicare's. You know, lots of people are on Medicare.
Yeah. They can even call those Medicare advantages, and the agent themselves will say, "Yeah, I think we cover that." And so they'll come back to the agency like, they said they'd cover it. It's like, no, they don't.
I would say that's probably something we hear weekly, probably multiple times. It's just I'm not sure that problem needs to be fixed. Mm-hmm. Like it really does need to be fixed for people because it just creates more confusion.
Yeah.
You know, and so I just say reach out to an agency and help you navigate what service that you qualify for, that your insurance will pay for. And I would probably just go back for a quick second about long-term care, because the long-term care policies can be that difference for people. Mm-hmm. So if, you know, you have a long-term care, some of those people can't really afford to pay out of pocket. They can't really afford 24/7 care in the home, or even less than that. But they've paid into this policy all these years. That's your solve for this. People in the middle.
Yep.
That's the solve. So I would probably encourage people also to just call around and check into a long-term care policy.
Yeah, and we haven't had the insurance agent on yet.
Yeah, sorry, I
to get all the details on that. But I'm glad you brought that up, because I think, and just, you know, miles may vary for people, but if you check with your insurance agent, sometimes there's a rider you can put on a life insurance policy, and they have. It's kind of like, instead of a reverse mortgage, it's like a reverse life insurance policy that allows you to get some funds for home care and staying in your home. Yeah. And I think sometimes people don't know those resources are out there. Mm-hmm. And so they feel kind of stuck. They know mom and dad are declining, and they're like, oh boy, what are we going to do? Going to an elder law attorney early on, trying to get that information, talking to an insurance agent, getting a true quote unquote long-term care insurance late can get very, very expensive.
Yes.
And, even at some points people might be like, well, it's too late, but check into the life insurance side of it, because there might be a rider on there that will allow you to get some funds extracted long enough to get some care for mom and keep mom and dad in their home. Even if you can't long-term keep them there, if you can give them a few extra years in their home, they're going to be happier about that. And you will too, I think.
Yeah. Yeah. I think where people kind of run into an issue is that, mom or dad goes to the hospital and all of a sudden they have all of these health concerns. And now all of a sudden they need all of this help, and they haven't even begun to start the process of an elder law attorney or Medicaid, and then they need this right now.
Yeah.
And those things take quite a bit of time. So,
well, from a home health side of it, I don't think people realize that a lot of times they think mom and dad are going to decline very slowly. Mm-hmm. And they don't realize that a lot of people decline very, very slowly. And then all of a sudden it's all at once.
Yeah.
And so they have something major happen, and it throws a wrench in everything.
Yeah.
And, sometimes if they're not prepared, they're going to default to the nursing home or a skilled nursing facility. And that's not necessarily the level of care that you have to stay. Like, going home is possible. It's just being a little bit prepared now will make a huge difference to be able to allow somebody to still go to their home. Because having that conversation of you're not going home, oh my gosh, it is.
Yeah.
It's a tough one.
Yeah.
It really is. I've seen a lot of families call me and be like, can you help us have this conversation? I'm like,
No.
it's tough. It's really, really tough.
Yeah. Yeah, just the sooner the better. Start with a little bit of care. We'll already have things set in place to where it's so much easier to add care.
Yeah.
It is a lot harder to be like, oh, we need around the clock care. And that's a little bit tricky to set up really, really fast.
Definitely.
So.
Definitely.
Yep.
Well, thank you so much. You've helped explain a lot about home care for people at home. Please don't waste time looking into all of these services. One last question, though, before we head off. Why did you become a caregiver?
Because I wanted to help people. I mean, that's just it's that simple. Like I guess you can do lots of things maybe to where you feel like you're helping people.
Yeah.
For me, it was the elderly population. They just kind of always had my heart. Like they're just so sweet, and they have all these stories, and it's just amazing the things you can learn from them, and that they can teach you. I mean, I always tell the story, but I'm like, I couldn't even cook when I became a caregiver. Like I was the young caregiver in orientation class who could not cook at all, and one of my first clients had said, "Oh, honey, will you go in there and make me some biscuits and gravy from scratch?" I'm like, "Well, I tell you what, I would love to make that for you. And if you'll just come right in here and sit with me at the kitchen table and walk me through that, I will be more than happy to make that for you." And she sure did. And that's literally how I learned how to make biscuits and gravy. And it gave her something to do that day.
Yeah.
So it was really cool. But I tell that story in our orientation sometimes. So.
I noticed that as much as I wanted to help older people, they really wanted to help me. Mm-hmm. And I let them most of the time. I took their advice. I listened to their stories. I tried to learn as much as I could from their wisdom. And it was definitely a reciprocated relationship for sure.
Yeah, so. They usually teach us just as much as we're there to help them.
Yeah.
They're helping us in different ways. So.
Well, if any of you out there are thinking about doing any caregiving, please look into it, because it is very rewarding, and it is a great, it's a great on-ramp to healthcare in general. I started out as a caregiver myself in the early days before I went to school, and when I got through school, I was a physical therapist, and then that led me to where we're at today. But I don't think I would have been where I'm at today without starting as a caregiver. It really did help solidify who I was, and really loved it. So, awesome. Amanda, thank you so much for being on the show.
Thank you for having me. I had a fun time.
Awesome.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.